If you have ever said to yourself, I passed HESI, but I failed ATI, or ATI was fine, but NCLEX questions scares me, it is not you. It is the exams, not you. So today I'm breaking down HESI, ATI, NCLEX questions using the same nursing content so that you'll be able to be comfortable when you see questions and how to approach it. This is based on requests I've got multiple times about content level. So let's get to it. First, I just want to know that these three exams, they are different in terms of how they test their content. The content is the same, but the way they test it is different. They test different level of what? Thinking. Once you know this, your score may change. So focus on the level of thinking that they're going to ask you, but that content is going to be the same. It does not change because it's in medicine, but the way they ask the question is different. How? This is what they do. SE want you to recognize that something is abnormal and they stop there. ATI want you to apply it using the nursing process. And the NCLEX want safety, prioritization. And so I'm going to use electrolyte imbalance to show you all the content associated with that. And I want you to write it down so that when you answer questions, whether you're taking any of these three exams, you can approach them in that thinking. Now, I'm going to use, like I say, electrolytes. I've given you multiple electrolytes there, and I've given you normal value, and I've given you signs and symptoms if the level is low. The key concept that usually everybody knows, these are electrolytes. If you need details about that, check Adapt and Class. I have electrolyte videos that you can watch. But these are some common signs and symptoms when the level is low. If your potassium is low, these are the things that will show up, right? When your calcium is low, you have tenderness and C and T signs. Those are the signs you may see, tremor and all those things associated with the electrolyte. This is the basis. That's not the main thing I want to talk about. How they give you those questions, how they frame it. So know the electrolyte, know the normal. But what do you have to do? Once again, pay attention to the way the questions will be framed and what you're looking for in the answer. Recognition for HESI, ATI application, and the NCLEX priority. What does that mean? This is it. We're going to take potassium. You know potassium, one of the favorite for both three exams. They love it. What is the problem? Normal potassium is 3.5 to 5. Everybody knows that. Now, if the potassium level goes up, your heart is in trouble. So think about the EKG changes that will happen, peak T waves. You may have dysrhythmia. These are all findings you have to be comfortable with. If the potassium is low, it affects your muscle. You have weakness. You can also have arrhythmia because of the low potassium. There's other signs and symptoms, but I'm taking this specific one to use it as an example. There are multiple signs and symptoms with hypo and hyperkalemia. This is not the content level. We're trying to learn how these test centers ask you questions depending on what kind of test you're taking. Now, let's take them one by one. Potassium is 6.2. I told you the normal is 3.5 to 5, right? Now, if it's 6.2 and the EKG shows a peak T wave, and if you're taking an exams, depending on which one you're taking, we can figure out what the way they're going to ask you. One, HESI, this is what they're going to ask you. Which electrolyte imbalance is present? That is all they care about. This is what they're going to ask you. It's a straightforward recognition question. Do you recognize that 6.2 of potassium is abnormal? If it's abnormal, what do you call it? The answer choice is what? Hyperkalemia. That's your answer. You don't have to go that far. That's all. You see, this is the way they're going to ask you. That's all you care about. You don't care anything about. This is what you care about, and that's what you're going to focus on. This is the way I want you to give it. So they give you a lab work and it's signs and symptoms, and they ask you, what are you thinking? This is all we care about. Hyperkalemia. If you take in ATI, they're not going to ask you to recognize that this is hyperkalemia. They know you know it's hyperkalemia. How do you apply it to nursing process? They will ask you which nursing action is appropriate. If the potassium is too high, what do you need to do? Place the patient on a cardiac monitor. That will be your answer choice. You're not going to say hyperkalemia because they know you know hyperkalemia. How do you do nursing intervention? Yeah, this is part of the nursing process. Place the patient on the cardiac monitor. That's your answer because this is asking you an action. You have to do something. But if you're taking the NCLEX, that's not what they're going to say. Nursing action is appropriate. Well, no. You see the word first there, prioritization, because the potassium is too high. What is going to happen? Not what you're going to do, but what you can do to prevent the patient from dying. Placing the patient on cardiac monitor is not enough. Cardiac monitoring, you monitor the patient before you even call the doctor. Continuous monitoring. Will be your answer choice when you're picking a question answer choice on the NCLEX. It's different from ATI. You just place the patient on cardiac monitor. That's the intervention you do. But the action you take first, you have to continue to monitor the patient, and then you let the provider know. Doing something before the provider intervenes is the main idea of NCLEX. Safety, safety, safety. You see the difference? Now, this is the summary of that. So for HESI, I just recognize that this is hyperkalemia. For ATI, it's an application form. I place the patient on a cardiac monitor because potassium is high. But NCLEX priority, I need to keep on continuous monitoring before even the provider even tell me to do anything. That's the priority. I'm preventing anything that will kill the patient. Know the difference. If you know what you're looking for, on the questions, no matter what they ask you, say NCLEX, priority, safety, safety, safety. This is the way I will approach the question. Now, let's continue. Same scenario. A client has a sodium level of 124 and is confused. What do you think the SEO is going to ask you? What do you think ATI is going to ask you? What do you think NCLEX is going to ask you? Think about it. What would they ask you? Which electrolyte imbalance is present? I want you to stop the video and put it down in the comment. If you're taking SE exams, what would you put over there? Sodium of 124. Do you think this is normal or abnormal? This is abnormal, clearly abnormal. You don't care about the confusion because that's not your business. All you care about, you recognize that patient is confused because they have what? 124 of sodium, and this is called what? Hyponatremia. That's all. Don't overthink it. You don't care if the patient die or have seizures. Your choice is to pick that. You recognize it. That's all. ATI say, hey, you got to do something better. Nursing action. What would you do? You know hyponatremia is associated with something. What is going to happen to the patient? An expected finding of low sodium is what? She's going to have seizures. So what do? Seizure precaution. That's your answer choice. But that is not enough. If you're taking NCLEX, what do you think we're going to do? Do we just do seizure precaution? Negative. If you know the answer, put it in the comment. Stop the video and put it in the comment. If somebody is having seizure, what is the number one thing that is going to cure them? Airway, airway, airway. Therefore, this patient, we're going to protect the airway. What are we going to do? Place them on their left side. Make sure they're on their side in case they have seizure and they're vomiting, they don't affect their airway. Are you still going to do seizure precaution? But you're also going to place them in a left lower and lateral position and protect their airway. do things to protect their airway, have suction available, all the things you need to do. That's the answer choice you would do. You see the difference? One condition, different way the test is being asked, but based on the content. A client report tingling around the mouth and has positive C sign, right? Trusted signs, right? What do you think? If you're taking an essay, put it down in the comments. Let me know. What does this sign means? And somebody have tingling around their mouth. What do you think? The question they can ask you, which electrolyte imbalance will present like that? That's your question. You don't care about the pathophysiology, the signs and symptoms that will affect the individual. All you need to know is tingling in the mouth and C sign. It means what? What does that mean? It means you have what? Hypocalcemia. That's all. That's your answer choice. And then you move on. But ATI will want to know, what do you do? Which action should the nurse take? Remember, you're focusing on just the nursing process. All the answer choice has to be related to nursing process. If you go over there, you're picking the wrong answer. Think nursing process. So what do you want to do? You want to prevent something. So you prepare to do what? Administer calcium gluconate, because that's what is going to take care of that. Right? Patient has low what? Calcium, he needs calcium replacement. Which intervention should the nurse do? Which intervention is the priority? If it's the NCLEX. Hypocalcemia, if it's the NCLEX, what would the nurse do? What do you think? What would the nurse do? This patient has to be on the cardiac monitor because they're going to go into cardiac arrhythmia. That has priority more than giving them calcium gluconate. I know I need to give them calcium gluconate, but the first thing before the provider give me an order, I need to place them on a cardiac monitor so that I can monitor them before they go into cardiac arrhythmia. You see the difference? I know what is going to happen. The provider is going to give me orders. I'm going to give them calcium gluconate, but that's not my priority. My priority is to prevent harm. The time you're waiting for calcium gluconate, they may be dead. Put them on a cardiac monitor. Same thing, magnesium 1.4, and patient has tremor. If you are HESI student, let me know what you think down in the comments. What is that? Is magnesium normal? No, because this is hypomagnesemia. It's very, very low, which electrolyte imbalance is present. They're going to ask you to recognize it. They don't want you to overthink. Do you recognize this is abnormal? If it's abnormal, let me know. If you think it's normal, yeah. ATI will say nursing process. Which findings should the nurse monitor for? A low magnesium and tremor, what would you monitor for? That means you know what is going to, in the nursing process, you got to intervene and do something. That means you're going to monitor for what? What do you think? It's the same as the calcium. Cardiac arrhythmia. So monitor for cardiac arrhythmia. But that's, how can you do that? How can you monitor for cardiac arrhythmia? That's your answer choice. Monitor for cardiac arrhythmia. But NCLEX want you to do that before even you get an order or do something. So monitor for cardiac arrhythmia is not enough. You got to say initiate cardiac monitoring. And that's why those answer choices are different. By saying the same thing, same idea, I'm initiating cardiac monitoring. I let the doctor know that we have what? Low magnesium, patient has tremor. I've already done that. ATI would not say initiate, it will say cardiac arrhythmia. I'm looking for cardiac arrhythmia because that's the nursing process. And the last one, a client with the COPD has the ABG of that. pH of 7.3, PCO2 of 55. ATI, AC, NCLEX are different the way they're going to ask you. What do you think SC is going to ask you? Think about it before I show you the answer. Put it down. They're going to ask you, do you think this is normal? And what is that? How can you recognize that? pH of 7.3 and CO2 of 55, like I said, they will give you numbers, lab values. They love lab values, and you have to identify whether this is normal or name it. Name the lab value. 7.3 and PCO2 of 30, name it. Give it a name. That means you recognize it. What acid-base imbalance is present? Name the thing. This is what. What do you think? How can you name this? Put it down in the comments. Let me know. It's respiratory what? Acidosis. If this is respiratory acidosis, what are you going to do? ATI? Which nursing action is appropriate? It's a COPD patient. What nursing process will you implement in order to help with this acidosis? Nursing process, right? What would you do? Sleeping, right? Sleeping is the best way to do that. That's what you're going to do to improve the oxygenation. You see the problem? That's the key. That's what you're going to do. But what is the NCLEX going to say? Which action is a priority? This guy is in trouble. What do you think? CO2 is 55. He's going to die. His CO2 is getting to 60. He will be going to 60 club. And what is his pH? 7.3. That's bad. What am I going to do? Assess his respiratory status. Assess his respiratory status and give him oxygen. There's different way these questions are asked, and think about it. Always, if you think about the test you're taking, the questions are easy. Therefore, AC will say, want you to identify what is the problem. If you can name it, you're doing good with AC. If you cannot name it, you are in trouble. If you can apply the nursing process, you are doing good. And if you can protect life first, hey, that's NCLEX. Therefore, if you're taking AC right now, I want you to learn how to recognize abnormal lab values and name it, give a name to it. Learn how to name situations, signs and symptoms, and name it and say, this is it. And the ATI, when you see the problem, go to your nursing process. Don't worry about it. Don't worry about who's going to die or anything like that. And for the NCLEX, protect life. Protect life as much as possible. Every question, can I do something and prevent the patient from dying? That is why a bunch of questions are on risk reduction and everything. And if you're taking NCLEX, stay with me, because this channel is designed to build your clinical judgment and your prioritization. And therefore, this is a home of content simplicity to help you master that. Thank you for watching. And once again, whichever test you're taking, think that way. And good luck in your exams. And if this helped you, just put the like button, put a short note, and subscribe to our Data Class for more content like that. Take care of yourself and bye.